All right, hello. We're going to be talking about a poop problem, pretty much Cyclospora Outbreak. It's Michigan's explosive diarrhea problem. They've been pooping all over the place. Yeah, yeah. So we're going to talk a little about it, what it is, the illness that gets affected, some treatments that are potential outbreak locations, mostly in Michigan, the beginning of it, food impacted, as well as how you could protect yourself, and some final thoughts. So, first of all, what is it? It's a protozoan. It's a single-celled organism. Kind of weird. It kind of only affects humans, this one in specific, so the chance of us getting it from an animal that is not a human is low. How does it spread? Well, poop. I poop. I have protozoans in me. I poop. It gets on your lettuce. You eat the lettuce. You are now infected with Cyclospora, also known as Cyclosporiasis. And that is the illness caused by the protozoan, pretty much. One thing to note is it's not immediately infectious, so the moment I poop onto your lettuce, and if you eat the lettuce immediately after, you're most likely not going to get sick, because it takes about a week to 2 weeks to actually become infectious. So once it leaves a body, it needs around that much time to pretty much be in the environment before it latches onto lettuce, berries, fresh produce generally in this situation. Could also be in water. Water could also be impacted here. Nobody knows. The reality is that nobody knows how it's happening, where it's happening from. Nothing in specific is mentioned at all. No specific food, no specific farm, nothing in specific at all. That's all under investigation by health officials right now. All right, let's get into it. Pretty much, the protozoan is tiny. It's not like a worm. It's bigger than a bacteria. It's like a human blood cell. It's that big. And you can't see one human blood cell, so it's pretty tiny. What happens with the illness? Common symptoms include explosive, watery diarrhea, stomach cramps, gas, bloating, nausea, loss of appetite, and for all you Ozempic people, weight loss. So you don't need Ozempic. You could just take some Cyclospora. Other than that, without any treatment, the effects can last several weeks up to a month. Relapsing, pretty much you feel better, you stop having that explosive diarrhea, and then it comes back. And it keeps going on for a month, about a month, a little longer sometimes. The treatment includes an antibiotic known as trimethoprim sulfamethoxazole. Common brands include Bactrim or Septra. Please note that these are sulfa medications, so not everyone could take them, mostly due to allergies. Pregnant women, right? They can't really take them sometimes. Blood and kidney disorders, or if you're taking any other drugs that could affect the sulfa medication. Just know that you need to contact your healthcare provider. Don't listen to a YouTuber. Don't listen to TikTokers or anyone on social media. Go contact your health professional. So we're going to look at statistics. Confirmed CDC outbreak is 1,600 people, a little over. Why there are more broader reported illnesses is because Michigan, for example, is reporting all the cases that people have, not just the confirmed ones. But the CDC are confirmed lab analysis cases. These type of illnesses and outbreaks are generally underreported, so maybe 10,000 people have them, only 2,000 people are going to go to their doctor and say, hey, I'm having a watery diarrhea. It's weird, Shove a probe up my butt. Take a lab sample of my booty. Other than that, hospitalizations, there's only 140 and 0 confirmed deaths, so you're not going to die. Isn't that good? Outbreak is mostly in Michigan right now, but it's also impacting Ohio, Kentucky, West Virginia, as well as 34 other states. The beginning, currently, we know that human fecal contamination occurred. We just don't know where it entered the food supply. Current theories include contaminated irrigation water, wash water during food processing, inadequate sanitation practices, or other environmental contamination occurring before produce reached consumers. What food is impacted? Mostly lettuce, leafy greens, primary focus of the investigation due to repeated reports by infected individuals. In previous outbreaks, it's also infected cilantro, basil, raspberries, or as I like to call raspberries, snow peas, salad mixes. At this time, no specific food is implicated. Now, opening this image here, what happens? Someone with Cyclospora and Cyclosporiasis poops. It takes 1 to 2 weeks for it to develop in the environment and become contagious. Once it becomes contagious, contamination occurs with food or water. And then ingestion. Somebody has to eat the contaminated food. Then those oocytes release sporozytes into your small intestine, which invade your intestinal lining. Within the cells of your small intestine, Cyclospora reproduce asexually and sexually. Very nice. And then they pretty much develop in your body until you poop them out again. And once you poop them out, the oocytes, then they go back into the environment, and the cycle continues on and on and on until we decide to stop it using treatment or identifying the outbreak. So inside your body, it could take 2 days to 2 weeks before you actually feel that watery diarrhea cramps. All right. How do you protect yourself? Wash your produce. What's being recommended by governmental officials is that you don't buy the pre-mixed greens. You buy whole produce, and then you rip off the outer 3 layers, I believe they're describing it. The other way of protecting yourself is cooking your food. Even though it's raw produce, you could cook it, put it in a pot, boil some water up to 160 degrees Fahrenheit, and that's going to kill the protozoan. So cooking things kills things, which is good. Although washing produce helps, it doesn't necessarily remove the Cyclospora completely, but it's better than nothing. So wash your food, wash your produce, and cook your food. Any questions you have, you could always ask in the comments down below. Other than that, I bid you adieu, and I hope you don't have any watery diarrhea. And if you do, stay away from my food.